Good morning, everyone. Welcome to another episode of EMA Partners Leadership Dialogues. Today with us, we have a very esteemed personality, Mr. Gautam Khanna. Mr. Khanna is the CEO of Hinduja Hospitals and is also the head of Hinduja College of Nursing. He sits on two private hospital boards and is also a managing committee member of a degree college in Mumbai. He comes with more than 30 years of industry experience. Prior to Hinduja Hospitals, Mr. Khanna has led the country business and was the executive director for 3M Healthcare, heading the overall South Asia region. He also is a co-chair of the FICCI Healthcare Committee. He is also one of the national leaders on the Service Provider Forum for Nat Health, and he's an alumni from IIT Kanpur and IIM Calcutta. So, Mr. Khanna, the first thing that I see when I, read about all the accomplishments that you have, how do you wear so many hats, and how do you manage that with a smile on your face?
So Tarun, how I do that, I think one of the reasons I have to say is that I have excellent team and people who work with me. So they do a lot of good job. That's why I can do other things. So that the credit goes to the team. The other thing is that I think early on in my career, I have been taught the art of discipline and time management by my seniors, and many thanks to them. And so somehow I try and keep time to. So I allocate time for my physical health, my spiritual health. So I will do exercise, I'll do meditation, and I plan my office work so that there is some time for emails, some time for conferences, some time for so it is. So I try and do that. Not that I am perfect, not that I am able to do everything 100% of the time, but I try and organize things. So it's working till now.
And there is so much happening these days, especially because of COVID, Gautam. How has it changed the healthcare delivery ecosystem in the past few months? So how do you think this COVID is now redefining the ecosystem, your activities, the patient access, all of that?
Now, the thing to understand in this COVID is that all this, what I talked about pre-COVID, takes a certain kind of environment. For example, the rooms which the patients are in, and just to give you a perspective that a patient, when they come to the hospital, patient care means, of course, doctor has to give good quality treatment. Nurses have to give good quality care for 24 hours a day. The other departments, support departments of housekeeping and food and other laundry and all the other engineering, everybody has to come together to give a excellent patient care to the patient. Right. And this system, where this system was working as a well-oiled machine, suddenly in COVID era, we found that we cannot use these rooms anymore. Because what happens is that for non-COVID patients, you need a room which is a positive air pressures. That means air goes out of the room, the air conditioning is positive. While for COVID, it has to be negative so that no infection can go out from the rooms. I mean, it's understandable. But think about it that you have to reverse everything. And when you reverse everything, you cannot put a COVID and a non-COVID together. You cannot put the same ACs. You have to. So there's a lot of infrastructure change to be done. So first things which we did was we identified a separate building which we have in the campus, where we have made fully non-COVID, where all the air conditioning is suitable for COVID. Then you have to have different protocols, because one of the things is that we have been learning. We also didn't know, nobody in the world knew about COVID. But what helped us is that we quickly acquired expertise externally and from abroad and from India. So for example, our senior consultants were in touch with people in Italy, Wuhan, US, Korea. So they would external expertise, and we would quickly develop the SOP. And we developed a system of our task forces, one for clinical, one for non-clinical, which would talk every day and resolve all the issues. And so that every day, as we were facing new challenges, whether new directions from the government, sometimes twice a day, you quickly escalate it, resolve it, and then move on. So we learned very, very quickly in the first couple of weeks. Our engineering team, they did the infrastructure change, and you have to understand, staff is concerned that where will I stay if I don't want to go back home from a hospital because my old parents are at home. So you have to make arrangements for them to stay. Then what happens to people who are staff who are infected but mildly infected and asymptomatic and who are not allowed to be admitted in our hospital. So we have to make arrangements for their isolation centers. So lots of work being done to take care of the infrastructure requirement for patients, for doctors, for staff. And also now when you talked about the protocols, you have to arrange for, of course, clinical protocols our doctors knew and they were making it as per the guidance of ICMR and other places. But things like, for example, in COVID ward, it gets very lonely. So we were the first ones to introduce a psychological counselor for the patients. So it's just obviously free of charge. But but that, and then we've introduced a very lot of programs for mental health of our own staff because they are under stress. Right. See, because we have to understand that one, they are working in a difficult environment. Then secondly, there is a lot of press which sometimes is negative and they don't understand the reality, and these fellows are thinking, why am I doing this work after so much sacrifice and service? This is what I have to hear. So you need to continue to motivate them, you need to continue to take care of their mental health. And so for that we have had our psychiatrists being on call for for the week as per the schedule. So we've done that. We've done some kind of a Sampark program where we do communication and essentially a program to take care of the physical, mental, emotional, spiritual health with meditations, with quizzes, with some events. So just to make sure that the staff is engaged. So this COVID era, as I call it, it is not only about the clinical treatment of the patient. It is about lots of other things. It is about ensuring that all teams work together to deliver the care. Everything in the hospital works like a well-oiled machine. It's like creating a new hospital in the couple of months, which is impossible in the real time. And to ensure that everybody is engaged and delivering as per patient care. So a lot of these things, and in addition to that, we had to close our IPD services and our OPD services. So the patients are also concerned. So we started something new, like for example, we created a tele-triage for nurse, where nurses would guide our patients that this is what, when patient calls, what do I do? There is a helpline. So helpline talks to them. Then this, when physically patients are not able to visit, the government gave the approval for teleconsultation. So we started the video consult, and now it is early after the initial hiccups. Now it is a very smooth platform where doctors can see from home, they get access to medical files. So everything as per in a secure environment where the doctor can see all the previous records, they can give a digital prescription, patient can print it at home and take the medicine even if they are not in Bombay. I mean, we have had people from Bihar, Bangalore, Delhi taking treatment, which I think is a great convenience. So I think there are a lot of movement towards digital and exploring what are the new options possible in digital healthcare and using a lot of analytics to understand what is going on, what is the pattern. So I think in this COVID era, treatment is one, and plus complying with government regulations and all these what I've talked about to ensure that in future we succeed and we continue to succeed, because we've also had a financial crisis because of course loss of revenue. But you have to take care of financial crisis. You still need to ensure quality. You need to ensure staff is engaged. You need to ensure that you are taking steps that tomorrow, when this COVID minimizes, we are still at the leadership and deliver our motto, which is quality healthcare for all.
It's really good to see that, the kind of focus you're not only keeping on the patients, but also on the mental well-being of the healthcare workers, because at the end of the day, they are the ones who are leading this war at the forefront. So, Gautam, this is the question that is in the minds of everyone, and I would love to gain your perspective here. No one wants this to be the new normal, right? And people are still afraid to say, we don't know what will happen in the coming months as well. What do you see? Do you see a light at the end of the tunnel? Do we have to wait for the vaccine? Is there a future where we can look forward to traveling like that back again, or this is something that is here to stay with us?
So Tarun, I cannot answer this totality because obviously all prophecies.
I know no one can answer it, but I mean, what's your
I,
perspective? Because you're closest to the
I
field
give
here.
I give you my perspective that see I think the we are of course waiting for the vaccine whenever the vaccine comes, and but along with that, what we have seen is that if people take adequate precautions, which is the mask, like both people have masks, then hand sanitization, social distancing, the risk is minimized. My biggest concern is our population might think that virus has gone away, lockdown has gone away, virus has not gone away. I
True.
think they need to understand that.
True.
So from that perspective, they need to ensure masking, they need to ensure social distancing, sanitization. If they do that, the risk is low. Now, whether it will go away now or later, I don't know. But what I know is that in this period, in the last 4 months, 5 months, all hospitals, including ours, and all have learned how to manage this crisis, this disease. We have had excellent partnership with the government. We've had excellent partnership amongst the hospitals. So we have learned. So I think our duty as hospitals is to ensure that we will give good quality treatment for this crisis. But it's duty of our citizens to ensure that they take precautions and don't fall ill. So
Right.
that I think it's two-sided. The other part of this is I think there is a lot of need from all of us
Mhm.
to continue to educate each other, and the government of course is taking a lot of steps for that. But education, awareness. So and if you think about it, what COVID has taught us, COVID has taught us to take care of our hygiene, to take care of lots of other things which we were ignoring.
Mhm.
So, so some, I mean, at a personal level, I think many practices from this COVID era should continue to stay because it is generally for the good health of the people, and it's preventive health is important. People have understood the importance of health. People have understood the importance of preventive health. You see many people going on walks and gym and exercising and yoga, and I think it's a brilliant thing. So people should continue to do that. Now, whether it will go back to the old era, I don't know. But what I hear from my friends in the industry, many people are very comfortable working from home, although they
Mhm.
have to work much harder and
Mhm.
much longer hours. But I
Right.
think they're more comfortable, and people have suddenly understood that they don't need to travel 4 days a week because they can get things done from here, work from home. So I think that will continue. So there may be a version of what the future will be a little different from what we saw earlier. But I think it will be overall better if we continue to take precautions.
No, thank you for that. And like when you talk about even vaccines, because I worked with a biotech company in the past as well, it takes years, right? I mean, even if they are doing a approach where they are taking a platform to build vaccines and trying to, minimize the time it takes, but still, I mean, there are so many open-ended questions out there. Would we need a flu shot every year? Is there a vaccine by which the immunity will be there for years to come? I don't think science has answered any of that yet, right? So there is no end in sight that I can see. I mean, what do you think?
When the vaccine comes, so vaccine is, I mean, like, I think there are 140 or 139 trials going on in India itself.
Right, right,
So so obviously something will come very soon, and we've been hearing about Oxford
right.
vaccine coming very shortly with serum. So when that comes, let's say even if it comes tomorrow for hypothetical discussion, still it will take a couple of months to reach the citizens of the country. It's not going to happen in a week. So the panacea is not the vaccine, of course it is, but if we lead our life properly, of course it may happen to people. You can't avoid it, but as long as we take precautions, I think things will be okay, I guess. Now, who knows whether it's going to end in October, whether it's going to end in December, whether it's going to end in March? We don't know. But like we say that since nobody knows future, is where it's your word against my word. So best thing is that we all continue to do our job sincerely as best we can. That's all.
Right, right. So that leads me to an interesting question, Gautam. You know, as you're aware, almost 2/3 of the population of India is still not focused on the insurance side of it, right? And with this ever growing pandemic, it's bound to reach those tier two, tier three cities, and it's already reaching there, right? And so, how do you think the Ayushman Bharat and other insurance players can come in? And from your experience, how are patients right now paying? I mean, are they paying out of pocket? Are insurance agencies really proactive? How do you think a common man would pay for the treatment?
So one thing is, I think many insurance companies have come out with a COVID package, which they have come out. And some of them have converted their existing packages, which will include COVID, so that they are doing their part. Uh, Now the challenge with insurance is there are two. So one is a lack of insurance, and second is inadequate insurance. So I'm going to address both. Now, lack of insurance means that till couple of years ago, Indian population, I think only some 18 to 20% of people were insured because, and that included ESI and included the corporate insurance from the offices and so on and on. So, and ESI and all limits were very low, but they were insured a little bit, or CGHS, they were insured. Then Ayushman Bharat came. So now Ayushman Bharat talks about the lowest rung of the the country, so which is around 50 crore people. Now that there's a limit of 5 lakhs on that, and it covers multiple things, and we understand what it is. Now think about it. Let's talk about in a metro, whether Delhi, Bombay, Bangalore, Hyderabad, in a large tertiary care hospital, if you want to get any major procedure done in a single room, it might cost, depending on the city, between 5 to 7 to 8 to 10 lakhs. Okay, currently. And just extrapolate it for next 10 years. This 7 lakhs will become 15 lakhs. Okay. Now we talk about the level of insurance. Most people have an insurance of 2 lakhs, 2.5 lakhs, 3 lakhs, 5 lakhs. Obviously, it will not be enough. So when the insurance is not enough, you are always suffering and you have to pay from pocket. So I think what people need to understand, and through this forum, Tarun, I want to tell people that insurance is an investment into your most important asset, which is your physical body. I mean, we think we need to invest, so we buy gold, we buy land, we buy shares, we buy, all kinds of things. But what about your physical body, your physical health? So please invest in this. And insurance is a preventive way. Of course, you do preventive healthcare, but you also need insurance that in case tomorrow you are able to pay for it. And some of people say, oh, but I never use it. I tell them, I'm very happy that you don't use it. Best insurance is that you never use the insurance, because that means you are healthy. But the point is, and it is a small amount to be paid every year. It is something in our mind that we need to, the way we allocate money to go out and eat food and buy clothes, we need to allocate money as citizens of this country for health insurance. And that health insurance will go a long way. I mean, I'm going to show you a dichotomy here. When you and I buy a new car, new motorcycle, new bike, new scooter, and insurance is a must. Third party insurance is a must. Why?
Right.
Because they think that your scooter or a bike or a car needs to be insured and the government has mandated it. If that is a must, this human body, which is our vehicle, should be a must. So I think it should be mandatory. And I know you are reaching many senior leaders through your forum. So I'm going to urge all your senior leaders to make it mandatory in their corporate plans that for every employee, a part of their salary should be health insurance. You tell them that X amount of rupees from your CTC I'm going to take and put it in health insurance. This is not optional. So I think those kind of initiatives will help a long way. And of course, as long as people understand, see, because in this crisis, what has come out very clearly that people were not insured. So suddenly they're saying the cost is too expensive.
Right.
But you think about it, even pre-COVID era, the hospital cost was this. It was exactly the same or even much more, because in COVID era, the government has regulated prices and cut it down to drastically cut it down to much below what the hospitals are charging.
Right.
So hospitals are losing money in that. But having said that, still the cost is much because you were never insured. If you have to take out from your pocket, you are a problem. And now because it's a pandemic, it is widespread out. So the large population is getting affected. In a normal hospitalization, very few people get affected. So I think people are now suffering because they have not had insurance. It's like if I have insurance of 2 lakh rupees and my hospital bill is 1.5 lakhs, I don't have any complaints. But if my bill is 3 lakhs, I have a lot of complaints.
Really,
But if
yeah.
my bill is 5 lakhs, I would not be. So I think that has to be understood by people, that one of the learnings from this pandemic should be that going forward, I should focus on preventive health. I should focus on adequate insurance and treat it like an investment in your own and your family's health. Don't worry about it like an expense. Just do it.
Thank you so much for that, Gautam. I think I'm sure the viewers will pay heed to your suggestions because they are very pertinent. I mean, and all of us have to focus on keeping ourselves healthy. That's the preventive side of it, and then making sure when we have an adversity, we are well prepared from an insurance perspective. So thank you so much for that. Another interesting thing I want to ask you, Gautam, is I know you address your hospital there as Hinduja Parivar. So, which is really good to see the culture. So can you talk about like how did this came into being? What's the culture that everyone calls it as a Parivar rather than a company or a hospital? So how does that came into being?
So this culture obviously I have not created. I've got inducted into the Hinduja Parivar. So this is a concept and philosophy of our founder Sri P.D. Hinduja, and our the lady who built this hospital, Mrs. Lalita ji Reheja. She built this hospital. She was the daughter-in-law of Mr. P.D. Hinduja. She brought this culture, and then subsequently it has been followed up by all our trustees, like Ms. Vinu Hinduja you met, and Usha ji and Mr. A.P. Hinduja and everybody and all the Hinduja brothers, everybody in the family has been treating this like a parivar. The reason why we call it a parivar is because we have ingrained, it has been ingrained in all the employees of the hospital that what should be the quality of the patient care. The quality of patient care should be how you would treat your own family member if they were ill. So the moment you give that perspective, you suddenly find it is not a profession. So the nurses, the doctors, the attendants, the housekeeping, the engineering, everyone thinks of them as my family member. That if it was my family member, would I treat? So then suddenly the quality which you deliver to the patients and your concern for patient rises up manifold. So I think that Hinduja Parivar concept is a great concept, which is probably one of the reasons why it is leading our Hinduja hospital to the peak of patient care, of delivering quality health care. Because, when you are treating your own people, you are very careful and you are giving the best.
So, Gautam, two more questions that I have. One, I'll focus on the talent side of it. What are the areas that you see from a healthcare delivery perspective where you see demand coming up in the next 10 years or next 5 years, where you perhaps saw a dearth in this pandemic, in this crisis? So what are the areas that you think will be upcoming and people may want to focus on hiring there, or that's where the talent should focus on in the next 10 years?
See, one of the challenges which India has faced always was lack of doctors and nurses and paramedical staff. It has always been there. But for some, and we were able to manage it. But in this pandemic, it is now a glaring problem because now there is a shortage of nurses, there is a shortage of doctors, shortage of ICU doctors, there is a shortage of paramedical staff. So it's just shortage. So I think one of the things which has come out is that the government, I mean, the country needs to spend a lot more on making people who are super specialists, like for example, MD doctors and ICU doctors and people who can provide critical care, people who can provide infectious diseases care. They are also quite low. So if you find the number of people who are experts in infectious diseases is quite low. So that is a gap. and people who are in and nurses. I think one of the challenges we found is that nurses are, I mean, we all know that attrition was happening because people, nurses go abroad, and sometimes they go for higher level salaries in some other hospitals. So I think one of the things which industry can do is make the conditions of working for nurses, especially in hospitals, to be so conducive that, of course, financially they are taken care of, that they don't need to think about going abroad. Like all of us are not worried about going abroad because it's fine, but India is India.
Yeah.
So, so conducive to a working environment financially as well as career opportunities. If we can do that, then I think nurses will be taken care of. And doctors, I think doctors and nurses supply side has to be fixed. That more and more nursing colleges to be come up so that we get more employment. Medical colleges, doctors for specialization. Government is talking about increasing DNB seats. So let that be focused. We don't need twice the DNB seats. We need 10 times the DNB seats. I think that's the scale of the issue. And at the lower, the staff level, we still need people who are trained. I mean, so that also is an important thing. But I mean, all I can say is that this will be required from the delivery point of view for a hospital. But from an industry, overall healthcare point of view, I think there will be a lot of role for people who are going to take the lead and understand analytics, understand the digital side of healthcare, and either help in digital delivery of healthcare or in designing the digital healthcare. So people who can transform the conventional healthcare delivery into digital delivery will be in great importance. And of course, people who can provide digital health will of course be more important.
Awesome. No, that's good to hear. That's quite in line with what we are also hearing at EMA Partners. So thank you for sharing your thought there. Gautam, the next question is a bit on the personal side. I asked this question to everyone. What's your favorite quote and why? I mean, something that has inspired you.
I'm going to say that life and career is a marathon. It is not a sprint. Okay. When I talk about this, I'm talking about many things which go inside it, which means that whatever happens in your life or your career, we have to assume that it is an experience which will teach me and make me ready for the future. So everything happens for the good. So I really believe in that. And I have seen in the past that things which at that point in time one doesn't understand, now one realizes how helpful they were. And also the relationships and how you deal with people in your life will come back to you someday. So when you think of it as a marathon, you will not do any shortcuts. You will not compromise on your integrity. You will not compromise on your relationships. You will not compromise on experiences. But if you want to do shortcuts in life, this is not going to work. And um, I was going to say, that movie Three Idiots, where this guy says that money follows success. Success doesn't follow money. So I think one has to understand that if you do your work properly, high achievement, good work, and think of it like a long-term work you're doing. If you're passionate about it, you will have success. And many times, many of us, and we make mistakes, we do shortcuts, we think that it doesn't matter. Matters. And one learning which was not my favorite earlier, but it's now my favorite in the COVID era, so I'm going to tell that earlier I used to believe that oh, I don't know this, I have never done this before, so I cannot do it. But COVID exposed me to this, saying that lack of knowledge or lack of ignorance is not an excuse. Nowadays, you can acquire knowledge very quickly and expertise very quickly. So as long as you are willing to learn, And you can acquire expertise in anything.
As a parting note, is there a final message that you would like to share with our audience? All of us are going through a tough time, although you summarized a few of the points that you want the audience to hear, but is there a parting message you would want to tell the audience here?
So I was just going to say that for the audience, I've already talked about basic precautions to be taken. So they have to do their part, and think of it as that preventive health is very important. Insurance is very important. We've spoken about it, and people who are in healthcare industry who are watching this, I was going to say that whichever part of the ecosystem you are, let us all work to ensure that the ecosystem succeeds as a whole, because that is important for the health of the country. Because one part of the ecosystem succeeding is not enough. And we have found that partnerships, which of course our motto of the hospital, is founder is partnership for growth. I think it really is important. So as long as we can partner with each other, we can deliver anything, whether it's public-private partnership with government or with other players in the industry or ecosystem. I think success will be ours. And just last thing is my request to the citizens, that many times we get influenced by negative reports which are in the media about healthcare and healthcare workers. My request to you is to you please decide for yourself based on your own experience, because sometimes these negative press and negative comments will demoralize the healthcare worker, and if healthcare worker is demotivated, then healthcare won't be delivered as per requirement, and that will be a bigger problem for the country.
Thank you so much for that, Gautam. Really appreciate your time today.
Thank you, Tarun. Really appreciated the opportunity to talk to you.